Right now, there's a literal life or death reality unfolding in Central Africa. We're looking at a massive, compounding medical crisis in the Democratic Republic of the Congo, or DRC. What we've got is a deadly infectious disease colliding head-on with a sudden, complete systemic collapse of health infrastructure. It's a story of global policy, frontline medicine, and raw human survival.
How does a localized outbreak suddenly become a global emergency? Well, that's exactly the question public health officials around the world are frantically trying to answer right now. You see, an outbreak doesn't just happen in a vacuum, right? It exploits vulnerabilities. So today, in this explainer, we're going to trace exactly how a sudden lack of resources and a devastating delay in detection allowed a highly dangerous virus to slip right through the cracks and force the entire world to pay attention.
246. I really want that number to sink in for a second. That's the sheer number of suspected Ebola cases recently reported by the Africa CDC in the DRC's Ituri province. Now, okay, for a lot of diseases, 246 might not sound like a world-stopping number, but when we're talking about Ebola, literally one of the most contagious and fatal viruses known to humanity, yeah, this is a massive red flag. It immediately signals a scale that demands an immense, globally coordinated response.
Section 1. A global health emergency. Ebola in the DRC.
The really crucial thing to understand here is just how incredibly fast this spread. This virus hasn't just stayed contained in the rural mining areas of Ituri province, it's jumped borders. Cases are popping up in the DRC's densely populated capital, Kinshasa, and we even have laboratory-confirmed cases in Kampala, the capital of neighboring Uganda. So why did this happen? Well, public health experts are pointing to a catastrophic 4-week delay in detection. Literally, for an entire month, the virus just circulated completely undetected. That led to extensive, totally uncontrolled community transmission. By the time the world even knew it was there, it was already on the move.
Section 2. The funding freeze, a sudden policy shift.
To really grasp this outbreak, we have to look at the broader context. Experts from groups like Physicians for Human Rights are directly linking this undetected outbreak to a sudden policy shift in Washington, D.C. Following executive orders by the Trump administration to pause and review foreign assistance, nearly all U.S. global health funding to the region was abruptly frozen. There was absolutely no transition period. The assistance just stopped, literally leaving materials like USAID boxes discarded and programs abandoned practically overnight in places like Bukavu.
To put the scale of this into perspective, historically, the United States has been the absolute largest provider of humanitarian assistance to the DRC. We're talking about funding over 70% of their humanitarian action, literally billions of dollars for health security, malaria, and HIV relief. But this sudden freeze, it triggered a 90-day pause, immediate stop work orders, and ultimately a massive 56.9% drop in foreign spending. The key takeaway here is the suddenness of it all. Without any time to develop backup plans, the entire health safety net was essentially just yanked right out from under the region.
Section 3. A surveillance failure unchecked spread. Public health officials are calling what happened next a massive surveillance failure. When the funding evaporated, the resources used to monitor and test for infectious diseases vanished right along with it. Health workers were effectively flying blind. On April 24th, the first suspected victim developed symptoms, passing away just 3 days later on the 27th. But it wasn't until May 5th that authorities were even alerted, and remarkably, they found out via social media. By then, 50 people were already dead. Fast forward to mid-May, and the WHO is declaring a global health emergency. It's a terrifying window into exactly what happens when disease surveillance systems suddenly lose their funding.
Section 4. Abandoned in crisis, systemic collapse.
Ebola really is just the tip of the iceberg here. The funding cuts triggered a much broader collapse in everyday medical care across eastern DRC, which is an area already devastated by decades of conflict. We really need to center the human element. There's this devastating first-hand account from an NGO program manager in South Kivu. They were talking about post-exposure prophylaxis, or PEP kits, which are absolutely critical for survivors of sexual violence to prevent HIV and pregnancy. They noted that PEP kits are only effective if survivors can access them within 72 hours, adding, "Right now, we know that many health structures across eastern DRC have completely run out. It's awful. Restoring access isn't just about medicine. It's about basic human dignity and maintaining a system that survivors can actually trust."
And the tragedy absolutely extends to maternal health as well. A doctor in Kasai shared a heartbreaking reality, noting that severe cases have been observed, including uterine ruptures and maternal deaths related to home births. Why? Due to a lack of financial resources and a lack of patient outreach. Because the funding vanished, clinics had to raise their fees just to keep the lights on. So patients who used to rely on free care are now forced to either pay entirely out of pocket, which most simply can't do, or leave the facilities completely untreated.
Section 5. The ripple effect. Diseases resurging.
This entire situation creates these concentric circles of impact. The loss of free treatments and the suspension of vaccination campaigns is fueling multiple simultaneous health emergencies. But before we get into the other diseases, we really need to understand why this specific Ebola outbreak is uniquely terrifying. You might be familiar with the Zaire strain of Ebola. For that one, we actually have vaccines available, like Ervo and approved therapeutics. But the strain spreading right now, it's the Bundibugyo strain. For Bundibugyo, there are 0 currently approved vaccines, 0 approved therapeutics, and it carries a fatality rate of anywhere from 30 to 50%. So the usual medical countermeasures we'd rely on, they simply don't exist for this virus.
So while health workers are desperately fighting a strain of Ebola that they literally cannot vaccinate against, other deadly threats are cascading. Mpox awareness workers are going unpaid, meaning those activities have just completely ceased. Malaria rapid tests and quinine are incredibly scarce, which is forcing desperate parents to take their sick kids to traditional healers, often leading to severe complications. And for those living with HIV and tuberculosis, the antiretroviral and anti-TB drugs, which were mostly supplied previously by USAID, are highly disrupted. It is quite literally a perfect storm of infectious diseases resurging all at the exact same time.
Section 6. Restoring the safety net, what experts recommend.
So how do we actually stop this collapse? We aren't just looking at the problems here. Medical experts and groups like Physicians for Human Rights have laid out a really clear, concrete action plan. First, they recommend the U.S. immediately restore frontline funding specifically targeted at life-saving supplies, things like PPE kits, antiretrovirals, and infectious disease control. Second, the DRC government needs to step up to safeguard its own health systems and develop a real mitigation plan for whenever donors do eventually withdraw. And finally, the broader community of global donors has to ensure that any funding transitions are gradual, transparent, and provide flexible support directly to local NGOs. That way, the safety net never just vanishes overnight again.
Which really leaves us with this final, profound question to reflect on. What exactly is the global obligation to protect the world's most fragile health systems? When bureaucratic policy shifts in one part of the world, it can literally mean life or death in another. As we watch this emergency unfold in the DRC, it really challenges us to think about how incredibly connected we all are. What responsibility does the global community actually hold in preventing a localized outbreak from snowballing into a massive global catastrophe?